Hi, good evening. Austin Mayor Steve Adler. You got a minute? We're going to go through the COVID numbers today as they were presented to us today on the dashboard that people can look at. Also, Dr. Escott's presentation today, joint meeting between the County Commissioners Court and the Austin City Council. A lot of slides associated with that, so we'll just go ahead and just keep to that data here today. Let's go ahead and begin with the dashboard as we start with the key indicator dashboard for the virus. Take a look at the number in the lower left-hand corner. New admissions today, 84. That number is up from 68 yesterday, but the 7-day moving average, which is really the important number to take a look at, is at 77, and that's down from 81. So even with the 84 that we have here today, the 7-day moving average has gone down by 4. It's been a while since we've been under 80, so that's a good sign for us. Number of new cases today, 702. A little bit of a concern because it's significantly above the 7-day moving average. Again, what we've been seeing is what looks to be good news. We've seen, if you take a look at the chart, you can see how the number with this graphs out the 7-day moving average has gone up and then has come down. That's really the key indicator that we're taking a look at. I am concerned about the 702 number that we see. Positivity in the community is down, but not by very much. We were 12.8 the last 7 days. We've lowered it now to 12.7. So we're still on the edge. I mean, we have a downward trend that we need to make work, but this is not a foregone conclusion that we're going to end up getting better. The indications, the UT modeling that we looked at would seem to indicate that, but people just have to stay disciplined, wearing the mask whenever you're around anybody, not in your family. Keep social distancing, avoid large groups. So let's go ahead and stop that, and let's take a look at the second dashboard so that we can see how we're doing with respect to the ICUs and the like. So here is the second dashboard. The indicators that we take a look at here. Let's look at the Austin, Travis County numbers. Numbers hospitalized, 572. That's the count tonight. 579 is the 7-day moving average, so we're below that. 36 people of these 572 are in our alternate care site. It's good we set that up. We have capacity up to 50. We can expand past that if we need to. In conversations with the state right now, they may want us to take some people into our alternate care site from areas like College Station or Waco. So we're talking to them about our availability to do that, as well as some funding help if we're reaching outside of our area. Number in the ICUs tonight, remember we were over 190, getting close to 200, but 162 is the census tonight. 7-day moving average is 167, so we're just under that. Ventilators 96, the 7-day moving average is 100. So these indicators seem to be moving down a little bit under the 7-day moving average. Number of cases now over 66,000. Number of people that have passed away, 641. That's an increase of 10 people since yesterday. So 10 families that are dealing with the loss of a loved one in our city. That is a big number. The last number that's really going to go down will be mortalities and deaths, because that's the most trailing indicator. As we see cases go down and hospitalizations go down, as we see ICUs go down and ventilators go down, then we see fewer deaths. But it happens in that kind of an order. So those are the dashboards for us to be taking a look at. So now we're going to take a look at the slides from Dr. Escott. It's another way to look at the same kind of data, but a little bit more in depth. Gives us a chance to look at the demographics and the other information that we want to see and measure. Here is the number of new confirmed cases. This is a chart not unlike the one on the dashboard that had the color indicators. You can see here that the 7-day moving average, which is the line in yellow, kind of roughs out the daily count, which is in blue. You can see that the number of new confirmed cases has been heading down. At least the 7-day moving average has been headed down. So that's a good overall trend. This is new admissions. We were rising. We got to a peak that was higher than the one that we had this summer. And then that number seems to be going down. It's flatter than I would like to see it be. But again, with new admissions, a good indication, but we're not out of the woods. We are still in risk level 5, and we need to treat it that way. Here's the chart that shows us hospitalizations, ICU admissions, and ventilator use altogether. The blue number, dark blue number, is hospitalizations, generally speaking, a peak and then headed down. ICU admissions, number was going up, higher than it was here, staying just under the 200 ICU census number that we were trying to avoid, and early indications that the number might be going down. Ventilator use, which is the trailing indicator to ICUs, was rising, and now it looks like it's flattened out. I'd like it to see it going down substantially, but at this point we'll take the flattening out. These are the regions around the state. Remember, Austin is in region O. That is in the middle here. Notice all these are red X's. That means they're all over 15% of hospital occupancy being COVID related. Austin earned a red mark last week, which is why occupancy in restaurants and retail went down by the governor's order. But we are now just under 15%. If we hold that for 7 more days, then under the governor's order, the occupancy of restaurants and retail could go back up to 75%. So we're in that area where our daily number went down below 15%, but our 7-day running average has not yet. That's why it's a yellow star, yellow X. But other areas around us, area Q, which is Houston, is at 18.7%. El Paso, 19%. Dallas, 22% up in area E here. San Antonio, 24% in area P. So it gives you one indication how we're doing relative to the rest of the state, which is still in a pretty precarious place. Look at all those red X's. This is from the UT modeling report. They're showing now an R factor we saw yesterday of about 0.86. It's below 1, which means the modeling would indicate that the infection is beginning to go down, and that's represented by the aqua line that we see. This is hospitalizations. The green lines are the actual numbers. The gray lines are different projections. Each of those gray lines has an equal chance of happening. The aqua line shows us what is the median line. That's hospitalizations, and here are ICU folks, again, cresting here at 200 and then hitting down. Let's hope we see that. It'd be nice to accelerate that. This is cases by county. This line that's way at the top here is El Paso, and we know that they were the ones that generated that outbreak in cases. They've been, this is cases per 100,000 people in their city. Tarrant County had a significant increase. They had a lot of problems finding spaces in hospitals. These other lines here, the orange line is Dallas. The blue line here is Bexar County. Lubbock had a really high line, and this was in the news. Theirs came earlier than most others in the state. State put a lot of resources out there and caused their numbers to go down, and they continue to drop. Harris County continuing to rise, and then here we are in Travis County, trying to hold on to the benefit of the standard we represented. The area under the curve here represents kind of the total number of cases, and you can see per 100,000, you can see where we are relative to the area under the other lines. That would translate into saving lives. We can see that if we look at deaths per county, and that's what this chart shows to us. We have the same kind of colors that we had before. This is deaths per 100,000 people. El Paso up there, Lubbock up there. These four lines right here are the other four counties of Harris and Dallas. Tarrant County is the green line. Harris County is the yellow line. Orange is Dallas. Blue is Bear and San Antonio. And then deaths per 100,000 people, here is Austin, less than half of what it is in this county. Again, that's due to the behaviors and culture and customs in our city. Makes you proud to be part of a city that's able to do this. I'm proud that we're in a city where the percentage of people that are willing to take the vaccine is over 85%, and we're the only county in Texas right now that has that measure of adoption rate. All these things just make you're really proud to be living here in Central Texas. Here is the demographics, hospitalizations by age group. These lines up here show you the percentage of hospitalizations, certain age. These are the folks that are over 50 in our city. This line here that's going up, the orange line, is people over 80. So we're still having a growing issue with the oldest people. The most elderly in our community, 70 to 79, was headed up, kind of flattened out. A drop in 50 to 59, trailed by 60, 69 in this area. In the middle percentages, that's the middle age groups that we have in our city. Those are folks 20 to 29, 30 to 39, and 40 to 49. And then down at the bottom, we have the youngest age groups in our city. Another way to show that same graph, this one shows you not percentages, but actual numbers. You can see the folks in our city over 80 that have been hospitalized has gone up to 107, used to be 90. The number of people in 70 to 79, as we saw that number go down. 108 people in our city, used to be 119. 60 to 69, 86, used to be 120. Just another way of showing that same graph. This is hospitalizations by race and ethnicity. Blue line is white, non-Hispanic. The green line is Hispanic, all races. You can say this number has remained relatively flat in the upper 30%. Cities above that. Again, the one that's out of kilter relative to its population in the city, as well as increasing, is the line that shows us what's happening in the African American community. This is hospitalization by race and ethnicity, shows you the same data we saw on the last chart. This is positivity rate by week. Doesn't line up exactly with the 7 days that we used in the dashboard that had us at 12.7. This shows 12.6. But you can see how we were rising. We got up to 16.7, and the number continues to drop. That's a really important number. As we drop positivity in our city, it makes it easier and better to have more kids in school, also opening up businesses. This is, again, each of these clumps of colors represents a week. You can see that this is current week. The number has been going down. Each color represents a different race and ethnicity. Purple is white. Positivity remaining about the same. A decrease here in what is other. Native Hawaiian, other Pacific Island, a decrease in the gray area here. That was Hispanic, Latino, a decrease in Black, African American positivity, an increase in American Indian, Alaska Native. Very few people though in that category. Same chart based on age group. You can see the numbers that are growing up here. As we talked about, over 80 is going up. The other one that's still remaining high for us, 40 to 49, and also the 10 to 19, which are the kids that are in school. Positivity is higher in our high schools than it is in our preschools, but you can see what those numbers are. High school 17%, preschool 10.3%. We've opened the Regional Infusion Center. It has capacity for 90 people a day. Thank you to the state for helping staff this and set up this facility for us. This is the monoclonal treatment that President Trump got that is eligible for people in our community, especially those at risk that get the virus. If you go here early in the detection, it may keep you out of the hospital. Talk to your doctors, physicians about getting a referral to the Regional Infusion Center. Don't think that this is a treatment that's just for presidents. Picture of what it's looking like at the Austin Travis County Alternate Care Site. Again, we just saw that we were up to 36 people in this facility. Capacities of 50. We could go higher than that. Again, this is for people that referred from hospitals after they are stabilized and can the lower acuity folks. This is the chart we looked at for flu. You recall that 3 months ago, 4 months ago, 8 months ago, we were concerned about hitting December and seeing the kind of flu activity in our hospitals the way that we'd seen in the past, knowing that we just wouldn't have room given what we were anticipating to see in COVID, trying to get everybody to really drive down the flu by taking the flu shots and the like. And you can see we've met our goal so far of staying below 2%. And that's important for us to do. Remember, we are still in risk area 5. That's important. Don't relax where we are right now. With respect to, let's see if there's other stuff on here that's important. Austin Public Health has provided over 24,000 vaccines over the last 2 weeks. They're going to provide another 12,000 this week. So that's 12,000 a week using 2 sites. If you have not already, go on the website, register. You can register whether you're over 65 or under 65. You have insurance, don't have insurance. Anybody can go on there and register. It's just that among the people that register, we're only going to be contacting the people that are eligible, which right now are people over 65. But understand that we've only been able to get to about 10% of the people that are over 65. It's going to take several more weeks in additional supply for us to start working our way through all of the folks in our city that are over 65. We just have a supply issue. Know that we are getting the vaccine put into people's arms just as fast as we get them, as shown by this vaccine administration chart. Everything we get, we are getting out to people and putting it in people's arms. That's the information and that's the data. Took a while to go through that, always does on Tuesdays, but I wanted you to have that. City Council meeting tomorrow is Wednesday, so we won't do Got a Minute tomorrow. We will do it on Thursday because there's no council meeting on Thursday. When the City Council meeting is over tomorrow night, Wednesday, I'll try to do kind of a social media post to talk about how the city council meeting went. But Got a Minute, not tomorrow. We'll pick that back up on Thursday. You all take care. Good night, and please be safe.